Good evening, everybody. I was listening to the last panel discussion very closely, and what I got from what Ms. Narasimhan said was that when women will be in charge, everybody will be brushing their teeth. Twice a day for 2 minutes at 2 rupees a day.
I am so in charge right
now. Dr. Dhoble, let's begin with you. We're going to get into the whole family aspect of oral health care. What generational patterns have you seen within families as far as poor oral health care is concerned, and what steps can families take to, combat this?
In the family, this habits to be inculcated because the family is the first place where the oral health starts. And if the families, particularly the parents, if they are not aware about the importance of the oral health, they cannot pass on to the child. Earlier, we used to carry only importance of the oral health to the children to be given, and the school is to be there. But now we are stressing it should start initiating the family itself.
No, but what are the patterns that you're seeing of poor oral health care?
Yeah, poor
in your time
oral
at the front
care,
line?
because since there is no awareness about the importance of the oral health, so that part is not happening. So it should, from generation to generation, or we can say that now we should insist more about how the family can get involved into the oral health awareness, and how can the children also can be the part of that.
Kishwar, you and I are in the same boat. Every night I tell my kids they need to brush their teeth, and they say why, and not now, and later, and then they fall asleep, and then then there's that question of, should I wake them up because they've fallen asleep and they've just eaten something? Yeah. I mean, how have you made oral health, brushing teeth, oral hygiene fun and also non-negotiable?
Well, like they say that kids imitate what they see. And if they see you brushing with intention and joy, I think they just follow, right? So what I do, from the time Nirvair actually started brushing his teeth, Suyash and I have made it a point that we enter the bathroom with him and we brush our teeth with him. So, he sees us, and then like we compete, कि कौन first आएगा brushing में. So, like वो एक incentive है for him also, that, he's going to come first. So he's fighting with us for that. And we kind of make it fun for him, like they were saying, schools have these charts. So I have that chart on my fridge. It's like a magnet chart that I have on my fridge where he goes and, sticks every time he brushes. And at the end of the week, if it's complete, he gets like a little treat, or maybe just watch something with him, So we kind of do all these things.
Would you say it's become a habit? Would you say he'll do it if you do not actually push him to or take him with you?
I think so, because you know what? I bought him these brushes which have Spider-Man and Batman, okay, on it, like his favorite characters. So he kinds of alternates between, the two brushes every day. And there are times when he'll just wake up in the morning, he'll open his eyes, and the first thing he'll say, brush kare?
Really?
Yeah. And I'm like, ha, chalo,
well, hats off to you, Mom.
Yeah,
very well done.
So that is why I was like, it's me. So I am in charge of this because, frankly, I was never a child who liked to brush. But now I think I know the value of it, and I want to, get him to do it.
Dr. Dhoble, how do we change the mindset of people for them to get to the dentist for a regular checkup as a part of their, health and wellness routine?
First, for the dental checkup, typically they have been, in the parents in the family we have seen, if they tell about the pain in the tooth, then they scold them, means they tell the child, if you do some things, I will take you to the dentist. That should not be there. And they should encourage the child visiting dentist, or telling that your dentist is your friend, he takes care of your teeth, he takes care of your smile. This is how the child should be encouraged to visiting dentist.
How many times a year should one visit a dentist?
Twice a year
Twice a year. Every 6 months.
Every 6 months to be visited. And the importance of the visit is very important. The parent should tell the child that why you should visit the dentist. And they should introduce as a friend. Now we are introducing this program from Indian Dental Association to the KGs, and where what's he advise about visiting or taking all the childrens to the dental clinic as a part of that their visit. And the dentist explains everything about the chair, how the teeth are examined, even the probe and mirror or instruments are given to the child. Then they start brushing there, painting, all such small activities. If they are carried out in the particular in the clinic or in the school, they get involved into it.
How do we make brushing cool? How do we do that in schools? Give us an idea.
अभी के बच्चों से there's some children here. उनको जब आप chilled रहोगे ना, you're cool, they'll understand you better. And through the project-based learning and through experiences, I think children understand better. You need to be cool in school.
Well, speaking of role models who are parents, we have Kishwar here who's a role model. So talk to us about sugary diets and digital distractions and mindful eating.
Don't kill me, okay? No. So I don't want to be a parent who doesn't want to like give the child anything. Like obviously, हम भी तो बहुत खाते थे, right? When we were small, we used to eat a lot of candies and chocolates. So I have told him very clearly that every time he eats chocolate, he has to rinse or he has to brush.
One creative way to make oral health a priority. Dr.
Oral health can be made priority from the school, from the family, and it should become compulsory for every school, particularly. They should have one specific day or half a day that is dedicated for the school oral health and importance of oral health, and the children should be involved in some activities where if they are involved in the activities, then they start inculcating that habit.
No sweets in the canteen.
Oh,
It has
okay.
to be completely up to millet driven canteen hai meri. So we're trying to just withdraw sweets from the canteen. Yeah.
I think make it fun, like make the brushing and the whole process, of oral hygiene fun for them. Like, maybe storytelling while brushing or anything, like just, music or something for those 2 minutes that, he brushes aram se and
Some questions for the audience I have. Okay. When you are buying snacks for your kids, do you look at the label for sugar? Yes? Okay. One parent puts his hand up, who's a very informed parent who just conducted the last panel discussion as well. As well. The next question is, how long should we be brushing our teeth? Please put your hands up. 3 minutes. Really? Doesn't that do too much to the enamel? 3 minutes is a lot.
2-2-2 rule, remember?
The 2-2-2 rule, exactly. Is it 2 minutes? 2 minutes morning, evening, or 2 minutes combined? 2 minutes morning, 2 minutes
2 minutes
evening.
night,
Okay, I'm
yeah.
guilty of brushing my teeth for 1 minute only. I'm always in a hurry, but 3 minutes? Definitely not. Not? Okay. 3 foods that are actually good for your teeth, great for your teeth. No one.
Apple.
An apple a day keeps the dentist away, but don't keep the dentist away. Visit the dentist once a year or twice a year. Yes, twice a year. Any other foods? Okay. Milk, calcium, yes. Cheese, sure. Yogurt,
Veggies? No?
yes. Crunchy vegetables,
Raw
Balanced diet.
balanced diet, good for the teeth,
Thank you.
always. What is that one dental myth you always find yourself clearing for patients?
The answer is स्केलिंग से दांत वीक होते हैं. ये एक बहुत कॉमन मिथ है, बट स्केलिंग कराना, ओरल प्रोफ्लैक्सिस is the best way to keep most of the disease away. The gums disease is very pertinent, and during the cleanup itself, we can have a look at a 360-degree view of the patient's mouth. We actually know कि situation क्या है, क्या grade है उसके health का, and वो सबसे बड़ा myth है इस वक्त.
Thank you for this opportunity, Mandira. दूध के दांत झड़ने वाले हैं, why take care?
I'm a pediatric dentist, so I get to see that all. कैसे भी जाने वाले, why do you have to take care? And that's a question.
Sorry, क्या जाने वाले?
दूध के दांत.
दूध के दांत.
झड़ने
why
वाले.
oh, why do you need to take? Oh,
So
that's
they don't understand that it's a natural space maintainer. They have a life. Each tooth has a life there. For the first teeth to the last tooth, quite a long life they have. So they have a role to play for your phonetics, nutrition, and also. So it's a big answer as a pediatric dentist for me to do, but I do that.
The truth is, we all live in a country when we ask for toothpaste, we don't say toothpaste, we say Colgate milega ke nahi.
Colgate
So I've
hai
grown up brushing my teeth with Colgate toothpaste, and that many years gone by, I still use Colgate toothpaste. All right, thank you very much. And thank you very much to the panelists for that lovely discussion. Lots of creative ways to keep people brushing their teeth and taking care of their oral hygiene. Thank you very much to the panelists. Big round of applause for them. Thank you.